Let's talk swallowing exercises for dysphagia and dysphagia management. Please note that this is not a comprehensive review. I have other reels for that. This video is a really quick guide to what each of those exercises does and what each of them are called. I really just wanted to cover the most evidence-based and supported exercises because it's confusing, and I don't feel like a lot of speech pathologists are giving good guidance on this. I also think it's important for loved ones to understand the general swallowing exercises that we have in order to help advocate and provide support for loved ones. First up, there is no such thing as an all-purpose swallowing exercise, but the effortful swallow is likely the most all-purpose swallowing exercise we have. The target of the effortful swallow is to increase pharyngeal pressure and bolus clearance. Good for enhancing swallowing safety, function, and efficiency. Next up, tongue pressure training or lingual resistance exercises. The primary target of lingual resistance exercises is to increase anterior and posterior tongue strength to enhance bolus control and propulsion, essentially making it easier for someone to effectively move food back and enhance clearance. Next, we have the Mendelssohn maneuver. The target of the Mendelssohn maneuver is to prolong hyolaryngeal elevation, thereby increasing UES or pharyngoesophageal segment opening duration. Don't worry, I'll explain how to do all of these exercises in other videos. Next, the Shakir or head lift exercise and the chin tuck against resistance or CTAR. The goal of these two exercises are to strengthen suprahyoid muscles and improve hyolaryngeal elevation and pharyngoesophageal segment or UES opening duration. The classic Shakir exercise protocol wasn't always well tolerated, especially in frail patients, and that's where the chin tuck against resistance or CTAR comes in. This is a lower neck strain alternative with growing evidence that's often better tolerated in frail patients. The next exercise I want to talk about is expiratory muscle strength training or EMST. The goal of EMST is to increase cough strength by increasing the strength of the expiratory muscles in the lungs. So essentially what it does is it increases the contraction of the expiratory muscles, thereby increasing subglottic pressure. So it essentially enables that cough to be stronger. An important note about EMST, it is not indicated for everyone. You need to be careful to make sure you get clearance that an EMST is okay to do with a specific person that you're working with. Okay, that is a quick overview of the most supported and evidence-based restorative exercises that we have. I will go into these a lot more in future videos, specifically about how we do an exercise, what the specific dosage is, how we write goals, etc. For more educational content from the beginning to the end of life.